I've alerted the EICU. They'll be coming on soon.
1 or 2 people can make a difference in the lives of 60 to 100.
We are absolutely convinced that the impact on our patients will be very profound.
The EICU is taking care of my patients as though I was at the bedside.
And it becomes like another set of eyes and ears taking care of the patient.
Welcome to a place where seconds count. A place where the professionals are calm, but the decisions can mean life or death. This is the nerve center of the Health First VitalWatch program.
Hi, this is Chris from the EICU. How are you? I'm just making my rounds. I wanted to ask a few questions about Mrs. Rosso and her care today.
Here, in the Clinical Operations Control Room, critical care physicians and nurses use powerful computer technology to monitor patients who are actually miles away. They're checking on every patient in all 62 intensive care unit beds at the 3 Health First hospitals: Cape Canaveral Hospital, Holmes Regional Medical Center, and Palm Bay Community Hospital. It's commonly known as the Electronic ICU, or EICU, Center, an added layer of patient monitoring 24 hours a day, 7 days a week. VitalWatch nurses and doctors can even make virtual rounds using cameras and microphones located in the patient rooms and operated by remote control right from the EICU Clinical Operations Room. Every patient is checked using a schedule based on how sick they are, and automatic visual alarms, known as smart alerts, make sure that even a subtle change is picked up. Bill Waltz spent almost a month in intensive care after a motorcycle accident. His family appreciates the added level of care.
Well, I guess it's just extra comfort to know that, he's always watched and to make sure he's taken care of, and I don't know, it's a good feeling. It's you're more comfortable with it,
Patient privacy is built into the system. A bell signals when the camera comes on, plus pictures and audio cannot be recorded.
Dr. Schaefer, could you come look at this patient's rhythm?
The technology is impressive, but it's the people who truly make the difference. The doctors who work here are called intensivists, experts in managing the care and treatment of the most critical patients.
We have very highly trained intensivists, but they are limited in number. Across the country, if you tried to staff every ICU bed with an intensivist, you'd probably need about 30 to 35,000 physicians who are intensive care trained. In actual fact, there's only about 6,000 in the country.
VitalWatch leverages that expert care, effectively putting an intensivist in every ICU room. They constantly monitor and can be called by a nurse with the push of a button. Hospital attending physicians select the level of VitalWatch care they want for their patients, from just basic monitoring to full-service care with an EICU intensivist making treatment decisions when the patient's doctor is not immediately available.
Heard your heart went a little bit crazy last night, huh?
Yeah.
Did you feel that?
The other night, one of my patients who was very unstable to begin with, who had had a heart attack, went into a very rapid tachycardia, or fast heartbeat from the top of their heart. The EICU recognized this immediately, as well as the fact that there was only one thing that could be done in that situation, and that was sedate the patient and shock them back into their regular rhythm. And it's that prompt action, I think, that immediacy of medical care from the EICU that actually gets people out of the ICU quicker, because realistically there are less complications. Things are being recognized and treated much more adequately and much more promptly by the EICU than they could be by myself or by the hospitalist. If I had to give you my gut feeling, I'd say yes, it will save lives, but certainly it's going to improve patient outcomes. I'm convinced of that.
The numbers back that up. VisiQ, the company that created EICU technology, studied the impact at a large Virginia health system. It found a 27% drop in patient deaths during the first 6 months and a 17% reduction in the length of time spent in the intensive care unit. And that translated into a financial savings of more than $2,000 per patient. VitalWatch is the first EICU in the southeastern United States, instituting a level of expert physician care that many large employers are demanding when they purchase healthcare for their workers.
Our number one responsibility is to do everything possible to improve the quality of our outcomes and the care for our patients, particularly our sickest patients. EICU represents, I think, the best advance in the care and treatment of critically ill patients that I've seen in 30 years in the industry.
The biggest benefit that I see to the EICU and being able to work in the EICU is that we are now promoting crisis prevention instead of crisis intervention. Crisis intervention costs lives and dollars. Crisis prevention helps save many, many lives and eventually many, many dollars.